Welcome. This is Dr. Maurice Scholes, and I'm happy to tell you a little bit about emPOWER NOLA. The New Orleans youth are living with significant trauma. This reality negatively impacts students' learning and achieving. It also contributes to the high rates of disciplinary action against Black children in the school system. emPOWER NOLA directly addresses 3 of the 10 directives highlighted in the New Orleans Children's and Youth Planning Board's report, Called to Care. We are training in evidence-based services in the community. We develop allies in the workforce in the community. We create and maintain an interdisciplinary team. This is important because we're harnessing the talent of our naturally occurring social networks. You might have heard of them as our second line crews, our Mardi Gras Indians, and our social aid and pleasure clubs. Well, I'm proud to tell you that they're more than just a show. They're the glue that hold together our organizations and our communities. We're partnering that talent with school-based therapists and nurses that are familiar with the organized care system around providing support to children in need. Bringing those people organizing together in the school system with those culture bearers in the community, we have a chance to create magic. And that is the concept we're exploring here with emPOWER NOLA.
We address the poly-directing improvements in the mental health of our children by training our cultural bearers and our school health professionals to speak a common language. This enables a collaborative model of respect and exchange between those with community-based access to children, NOSNs, alongside those theoretically versed in trauma methodology without such culturally bonded standing school health providers.
Creation of the trauma-informed curriculum involved initially facilitating a deep dive into the literature and clinical practices around children living with psychological trauma. After curating reading assignments and facilitating discussion around trauma-informed training theory, I identified local professionals that have applied the theory and practice in New Orleans, which led to securing Dr. Deidre Hayes for a series of train-the-trainer sessions for the emPOWER NOLA clinical scholars. This allowed each of us to speak common language around trauma-informed training and apply it to our local community. Following the sessions to train Dr. Arnold James, Dr. Maurice Scholes, and Ms. Rhonda Jackson, I created the curriculum that will be used to train the naturally occurring social networks and school-based mental health professional dyads. The training is the heart of the emPOWER NOLA theory of change, where we're not only providing resources to health professionals familiar with the pedagogy of trauma-informed work, but we're also providing plain language instruction to community members of influence. This empowers communities to recognize when there's a problem affecting children, be aware of the resources to provide support, and appreciate the nuances of the education and healthcare system. Ultimately, the curriculum represents a proprietary product that can be scaled and modified to impact additional community partners and culture bearers seeking to facilitate change. Although the curriculum is not focused on providing direct patient care, it does create the infrastructure to get children living with trauma the support they deserve.
I'd like to present our project operations. Dr. Sunita Singh, clinical epidemiologist, is tasked with operationalizing the dyad training of the natural occurring social organizations and the school-based health professionals. She brings a wealth of experience in organizing qualitative impact projects and compiling relevant data generating by the process of engagement as well as product outcomes. Several survey instruments have been created to capture each major program process, with attention given to sustaining cultural competence and assessing the impact intended among dyad targets. Over the last year, she has supervised 1 paid undergraduate student worker and 2 graduate-level student workers to assist in program monitoring and evaluation, website development, and literature reviews that will be utilized to disseminate such information onto social media posts, journalistic posts, and academic literature. The project operations team, with Lisa Manning of Scholes Medical Consulting, has provided comprehensive support to the project as we prioritize advancement and provide tangible benefits to our community partners. In addition to documenting the process of community engagement, school engagement, and curriculum development, they have worked with the external affairs team to better translate the complex theory supporting the project into digestible pieces appropriate for the education of the lay public. The project operations team has created process flow schematics, infographics, and website optimization to support the overall goals of the project. In addition, this structure will facilitate future publications, white paper policy production, and clarity to our funding agencies around the impact of this project.